Welcome and good morning, good afternoon, good evening to everyone tuning in from all over the globe. Here in Atlanta, it's dark, it's 9 p.m. That means it's still World Field Epidemiology Day for us. So while it may not be September 7th for all of our webinar participants, I just wanted to give you an introduction to World Field Epidemiology Day, which was September 7th. World Field Epi Day was created as a global movement to recognize and raise awareness of the vital role that field epidemiologists play in promoting populational health. So we're really glad that you're joining us today for this webinar series that will undoubtedly help build our field epidemiologists' skills. We have a great group of speakers who will be sharing our perspectives throughout the month of September. So I'll start by introducing Michelle McPherson, who is coordinating editor for the Western Pacific Surveillance and Response Journal, or WPSAR. We're going to be saying that acronym a lot today. She is a graduate and previous staff member of the Australian Field Epidemiology Training Program, or FETP. And she's worked with many FETPs in the Western Pacific region in her role with WPSAR and has attended a bunch of TEPHINET conferences as a participant and also as a workshop facilitator. In her role as editor of WPSAR, Michelle works with authors to improve their manuscripts from pre-submission all the way through acceptance and publication. We also have the honor of having Ashley Arashiro, who is the other coordinating editor for WPSAR. Ashley manages the peer review and the technical editing process and monitors the progress of accepted manuscripts through to publication. And Ashley has 7 years of experience in editing and formatting research papers in the health sciences and helping non-native English speakers in the Western Pacific region submit their manuscripts to international journals. And then finally, I'll introduce myself. I'm Elena Atkinson. I'm going to be doing most of the speaking at today's session. I'm currently a project manager with TEPHINET, supporting our knowledge exchange, community learning, scientific communication, and conference activities. And I know personally, I'm really passionate about implementing international efforts to empower and train early career researchers on how to write and publish their academic articles. So today, we will just give a brief 20-minute presentation on how to convert your field epidemiology work into a publishable article, and then we'll open up the webinar for your questions. You can ask questions throughout the whole talk using either the chat function or the Q&A. The Q&A is like a specific question, and then either we'll answer it like spoken, or we can type an answer right in the box there. And then chat is more for just like back and forth interaction throughout the webinar. And then after today's webinar, we're going to be holding 3 more this month. The next one is preparing your manuscript for submission, then addressing reviewer feedback on your manuscript, and finally, how to be a good peer reviewer yourself. And we're going to try to keep all these sessions brief, about 30 minutes, so that we can avoid this infamous Zoom fatigue that's been everywhere over the past year and a half. So let's get started. So as you can see, today's topic is converting your field epidemiology work into a publishable article. And as I mentioned, Michelle, Ashley, and me. And I'll be doing the talking today, but if you have any questions about WPSAR or about their experiences as editors, also feel free to ask in the chat anything that you would like to ask about Michelle and Ashley, and that's what we're here for. So first, if you have not published before, you might be asking, why even publish your work? And there's a lot of reasons. Mostly, you're going to help contribute to your field. You also will deepen your knowledge in your area of work, and then you'll also develop yourself professionally. So first, you're going to just share information. So you'll build knowledge about the epidemiology of the disease that you're studying, and you'll also share lessons learned in responding to outbreaks. It's also an opportunity for you to learn more about your work. Maybe you can do a more detailed analysis of routine data, or you can learn a different perspective through the peer review process that otherwise. And then finally, just in terms of, you're going to practice your scientific writing skills, and it's an opportunity to connect and network with other co-authors. So if you have taken the decision that you're gonna publish your work, a lot of times the question is, okay, where do I start? I like to see this as the metaphor of like a cake and a recipe. Think about, is it easier to try to bake a cake on your own? You've never baked a cake before, just trying to scramble together some eggs and flour and butter, and you don't know what proportions. Is that easy? Or would you prefer to find a recipe and then you follow the recipe and then you end up with your cake? So that in this instance, the cake would be your article and the recipe would be the target journal's instructions. So a lot of times the journal will give you instructions on how to write the paper. So the step one would be to identify the target journal. So to do that, you mostly should focus on the audience that you want. So say you want to get through to policymakers, or maybe you want to get through to educators, or maybe you want to get through to other field epidemiologists. So first figure out your target audience. A strictly medical journal with primary care practitioners is going to be a very different audience than government policymakers. So what you should do is read articles from your target journal to get an idea, and then also follow the instructions to authors. Once you've determined your target journal, you would decide what type of article to write, as there are many different types of articles. So to find this, this is all good in theory, but you want to know what this actually looks like on a website. So we can show you the Western Pacific Surveillance and Response Journal. If you went to their website, it would look like this, and it has a section called About Authors or For Authors, and it will tell you the aims, the objectives, and that lets you know, who is reading this and who is your audience. So once you've established that, what you have to figure out is the type of article. So a lot of times we think, just an article is an article, but there's so many different types. Original research articles are the most common, but there's also literature reviews, which means that you just review other articles that have already been published and you compile them together into one. There's case studies, there's perspectives, and then there is also a set of articles that are specific to field epidemiology. So those would include outbreak reports, surveillance analysis, surveillance evaluations, other types of articles called lessons from the field, or even just a letter. So it's kind of, it can be confusing because the journal then also has its own set of formatting requirements, and they may or may not, coincide with the different types of articles. So for example, they'll have different sections. Maybe some, put the methods section before the results, and some may put the results section at the end. And then even the language, a lot of people think, oh, I'll just write it in English. Every journal accepts something in English. But even if you write it in English, there's American English, British English, Australian English. So it's a lot easier to just figure that out before you write the article. And then you write it, in American English, and turns out they only accept British. So it's a lot easier to just try to figure this all out beforehand. Also, the word limits. A lot of times the word limits are, I find, the most painful part of adapting your article. If you write 4,000 or 5,000 words, and then you find out the limit was 2,000, and you have to cut all of those paragraphs out, that can be that can be very painful to have to get rid of all this, hard work that you put into it. Also, the referencing format, it's a big, there's a difference if one is accepting Vancouver referencing style and another one is MLA and another one is APA. So it's a lot easier to try to figure this all out beforehand, before you write the article, than, do everything in APA and all of a sudden at the end you have to change. That's a lot of time lost. Another big one is the number of tables or figures and graphs. What if you are counting on having 5 graphs of different findings, and then you find out that they only accept 2. So it's a lot easier to figure this all out beforehand, before you write your articles, so that you can adapt it to that. So as some more examples from WPSAR, they have a very broad range of article types. So here are some examples, and you would find out exactly how to write these kinds of articles by going to the instructions to authors. So for example, the outbreak investigation report will include these kinds of instructions. So it says, it's a structured article. It tells you the sections. It says there's an introduction, methods, results, discussion. It tells you the abstract is also structured. There's a word limit, fewer than 15 references, fewer than 2 graphs. Whereas if you go over to the surveillance report instructions, the abstract is unstructured, same number of words, but it's unstructured. And then the word limit for the actual article is 2,000. So you can have a little bit longer than an outbreak investigation, same number of references, and fewer than 10 figures, graphs, pictures or tables. So if you want more information, you can go to the WPSAR website, but you can see how those instructions on how to format different articles can lead us to, a broad range of types. So now that you have your recipe that will tell you exactly, how many paragraphs go where, how many figures, how many tables, how many references, you can actually sit down and create an outline. So we would recommend that step one is just create an outline with the required headings. So if we go back to the previous example, they said you're going to need an introduction section, a method section, a results section, discussion section. So make sure you put that into your outline. And then this is just for your reference, this is the most common type of article structure. Sometimes we call it IMRAD, which stands for introduction, methods, results, and discussion. So if you ever hear about an IMRAD article, that's what this is. So now that we have the outline or the recipe for how to create our article, we tried to bring our reader into the context. So when we're writing, especially in field epidemiology, it's such a broad science. Somebody really in any part of the world could be picking it up and trying to learn about your outbreak investigation or your surveillance system. So remember that, somebody could be on their lunch break in South Africa or, riding the train in China, and they just pick up your article, but they're in a completely different context than your study, then maybe you're in Australia or you're in a different country. So what we have to do is bring these readers who can be all over the world in every level. Maybe they're a trainee or maybe they're highly experienced with lots of years under their belt. So we have to figure out, whoever they are, how to bring them into our study, into our study's context. So what we do is we first start by giving really general statements. So maybe we can give a brief description of the disease and say, diabetes is a problem in the entire Western Pacific region. So that way it's a more general regional issue. And then we bring that down into more and more detail into our actual study. So what we would suggest is you start with a brief description of the disease globally or regionally, bring that down to the specific context of the manuscript, and then also describe the gap in knowledge. So describe why this study had to be done. If you didn't write this article, what would have happened? What is out there that we don't know? So describe, you can say things like, while much has been studied about disease X, we still do not know, blah, blah, blah. We still don't know the mechanism of action, or we still don't know the prevalence in this region. So tell us what we're missing. And then describe how your findings will be relevant or have an impact. And then we conclude with the manuscript objectives. So you see how we went from something very broad that anybody in the world could pick up and read, and we're bringing them into why this study had to be done. So once we get very specific into the objectives, we jump into the methods. And this is one of the most detailed sections you can have. And the rule of thumb to remember for this is that you need to provide enough detail in your methods section that if you gave your data to someone else, they could replicate your results. So this, in my personal experience, peer reviewers are always asking people to take information out of the introduction. Like a lot of times we just go on and on about the disease and how bad it is. But a lot of times we know this, we're all field epidemiologists, so we have a wide knowledge about the kinds of diseases that are out there. And we have a lot of information about we have a lot of basic information about the disease. What we want to learn more is about your methods. So most often peer reviewers will ask you to take information out of the introduction and put a lot more in the methods. So yeah, don't skimp, and there's pretty much, it's one section of the article where you can never have too much information. So just go to town with this and add as much detail as you can. Normally this will include the study design, the setting, like what hospital, what institution, the participants, any kind of definition. If we're defining overweight as, you can use that definition. Sample size, any assumptions you made to get to your sample size, how you collected your data, statistical methods, and ethical considerations. Ethical considerations is a big deal actually in field epidemiology, because And in general, because a paper can be rejected if the ethical requirements were not fulfilled. A lot of journals take ethics very seriously, and you need to make sure that this was all well defined beforehand or described in your paper. And we know that in field epidemiology, a lot of times you get a call to respond to an outbreak and you run out into the, and you can't get ethical approval beforehand. Still, you would have to describe this situation, and maybe there's a law that makes you exempt from this requirement. But you would still have to describe this in the methods section so that the journal knows that you were exempt from this requirement. But ethics is very important, and journals definitely are rejected all the time for not fulfilling. So make sure that you're taking that into account. Then once we describe all our methods, we can go pretty much like in a parallel structure to the results. So everything that we described in the methods, so for example, the design, the setting, the participants, we would just describe the results in the results. So if in the methods, we started out by describing the setting and the population, here we would start by describing the results of what our study population looked like. So the total number of respondents, the response rate, anybody that you included or excluded, and then any kind of descriptive analysis. So just describing the percentages or frequencies. And then if you did complete any analysis, you can add that, or any multivariate analysis. So we would start again kind of with the more general or broad findings, and then go into really specific conclusions. Once we have that, we're going to have kind of a reverse of what we had in the introduction, where we go again from specific and then back out to general, so that we help our readers really incorporate these findings into their own context. So what we would start with is the specific findings. So, we found this and then related to the literature. If you had found anything minor, like maybe you weren't looking for it, you found something unexpected, you can add that as well. It's always important to include the limitations, because that affects how we take our specific findings and we apply them to a global context. So you can say maybe, the hospital that I was studying at had certain characteristics. So if your hospital is different, maybe they won't apply. Or maybe we got lucky and we got a higher response rate than normal, but we don't expect this to be common in all situations. So any kind of limitation that would affect how your results could be applied to others. And then just any effect of these limitations. So maybe you had a higher response rate than normal. Maybe, how would that affect your findings? Is that typical? Would it skew the results any which way? And it's really important to include limitations. A lot of people think that limitations mean that your study was done poorly, when that couldn't be further than the truth. It just means that you recognize that any kind of methodology has its limitations, and you're just aware of that and you're describing that. And then to conclude, restate your major findings or your message, and then a link to public health implications and any recommendations and future directions, so that your readers who are out there in the world can incorporate that into their own context. It's very important to reference everything. And it's, when in doubt, just cite. It's always the best practice. So make sure that you're using reputable databases like PubMed, CLO, Google Scholar, for anything that has to do with theory that will support your findings and your hypotheses. It's especially important to reference background information, so any kind of statistics on prevalence or baseline data, anything that supports your findings or anything that contradicts your findings, and then just any citation you need to avoid plagiarism. Citing a source does not mean that you don't know the result or something. It just means that you're incorporating yourself into the scientific community. If somebody else says that and I support it and I write about it, then I'm interacting with the science. So this is how editors make sure that we're interacting and we're in line with other articles. And finally, I know this is a pet peeve for Ashley and Michelle, that if you use referencing software, make sure to remove the formatting. So if you use like Mendeley, Zotero, EndNote, any of those referencing softwares, you have to change it into plain text before you send it, because otherwise it's going to show up for Ashley and Michelle as some text that they can't understand, and there's code, and the formatting does not work. So it's hard for them as editors. So make sure that you're removing the formatting. And this may seem obvious, but we wanted to mention this as a step. Just make sure that you proofread your manuscript before submitting. So many people just, you get down to the last minute to the deadline, and you're getting ready to submit, and you think it's easier to just submit. But no, it's very important to proofread. You have to fix any kind of typos, grammar errors before you submit. And then also just double check every figure, every table to make sure that the numbers are correct. And then make sure that the table matches what you're saying in the text. I know I've done this before. We changed categories. We ended up combining two columns, but we didn't change the text. So it seemed like some of the numbers that we were putting in the column weren't matching what we were saying in the text, and the peer reviewers caught it and they thought that we were making a mistake. But no, it was really just we had overlooked the fact that everything we said in the table wasn't changed in the text. So make sure everything is aligned, and then also just make sure that the citations match the bibliography. So if you're citing, study number 4, make sure that study number 4 is the one that you're citing. So just make sure everything is in tip-top shape before sending. And then we wanted to give you also just a few tips for actually converting reports, so field epidemiology reports, into a manuscript. So we would recommend starting with up to 3 findings. So I know a lot of times when we go out into the field, we have just a list of all the variables that it could be. It could be foodborne, it could be waterborne, it could be vectorborne. And we have all these findings and we end up getting so much data, but we don't recommend trying to publish that. What we would recommend is finding, your key finding, maybe up to 3 or 1 or 2 or 3, and start with that. Then work backwards. So if you found something really impactful in your study, start with a table or figure describing that finding, and then you decide to include that. Then you can include the results text that is associated with that finding. Then make sure that your methods describe how you obtain the results. So, if you're describing some kind of demographic data, make sure in the methods you describe how you collected that demographic data. So was it through a questionnaire? If it was, make sure in the methods you're describing your questionnaire. And then finally, at the end, make sure that you finalize the discussion and introduction. So we have those 2 kind of funnels on both sides to wrap up the article. So start with the findings and then work backwards to construct your story. And kind of what I was saying in the previous slide, while the article, you read articles from intro, methods, results, discussion, that's not how we recommend writing. So this is in any case, not just for field reports, but we recommend always starting with your data, because it's a lot easier to work with something that already exists, that's real, that's tangible. You have the table right there, you have the figure already, and then work backwards to get into more theoretical concepts and more policy. Those are a little bit more abstract. So start with your tables and your figures, because you already have that. If you collected your data, you have the data. Then just, describe them in your results. Once you've described all your results, you can describe how you got those results, in the methods. Like I said, did you collect information through a questionnaire? Okay, so then describe the questionnaire. Once you have the data, the results, and the methods, you can work on the introduction and discussion. And it's a lot easier to do those together as well, because a lot of times you can cite an article in the introduction and cite it in the discussion. So you can get your references going at the same time. And then finalize the title in an abstract, because that can just wait for last. And a lot of times we want to craft it to make it as impactful as possible. So we want to make sure we have all our arguments, all our data, everything, solid, and then we can go to the title and abstract. And then in general, when we're trying to write for publishing, just use simple, concise writing. So avoid complex words, just use short sentences. Think about who your readers are. They're just as busy as you. If they're field epidemiologists, of course, maybe they don't have that much time. They're running out to the field. So think about, do they want to read like a really long article with lots of complicated phrases, or do they just want the information? So make sure you're using just simple words, short sentences, and avoid passive voice unless really necessary. Passive voice is when we say like, the door was opened by Maria, instead of just saying Maria opened the door. Instead of saying, you know, it was Maria who opened the door, we're saying, oh, it was opened by. So yeah, avoid a passive voice if possible, and then just use headings and subheadings. Like we mentioned before, if you're doing a section on demographic data, that can be a subheading. And we wanted to share just an example here of what we mean by concise writing. So instead of saying things like there was a total of 1,256 suspected cases identified in the outbreak with onset dates, there was a peak, you know, the ages and the majority of suspected cases, and they were male. What if we just summarize that all to say, you know, instead of there was a total of 1,256, we could just say of the 1,256 suspected cases. And then we can describe the percentage who are male right there, and then put the ages all together. So just say ages ranged, you know, from here to here, and then just talk about the illness. You know, onset was then, and peak was then, instead of, you know, really dragging it out. So this is what we mean by just simple writing. And that's it for today. Do we have any questions? It looks like we have one in the chat, or two in the chat. So I think Ashley is writing a response to the first question. Let me skip to Peter's question. So Peter's question is, what do you see as the value of open access journals such as WPSAR for field epi? And any comments for new epis on how to avoid predatory journals? So this is a really complicated topic. Open access means that anybody can read the article. I'm sure we've all come across journals where you go to read it and then all of a sudden it says pay $30 to read the article, you know. So that would not be open access. Open access means that you can click on the article and you can read it. Of course, journals want to make money somehow. So a lot of times these open access journals will charge the authors. So they'll charge the authors like $2,000, $3,000 to publish, but then the reader doesn't have to pay. So it's kind of like a trade-off. The authors pay and then the reader doesn't pay. It's a very good idea and very important for sharing, because not everybody has you know, library access or a way to read these kind of closed articles. And there's even data showing that open access articles are cited a lot more and they're read a lot more because they're open. However, with everything online nowadays, it's hard to tell if a journal is asking you for money to publish open access, or if it's just what they call predatory. So there's predatory journals right there out there who will ask you for, you know, hundreds or thousands of dollars to publish, but they don't actually have a peer-reviewed journal. Oh, sorry, they don't actually have a peer-reviewed process. They're not a peer-reviewed journal. So there used to be a list called Bell's List, I believe, but that's since been discontinued. It was a list of predatory journals, but it's very controversial to define a journal as predatory. So what I would recommend is just Googling the journal's name and make sure that it's in a reputable database. So for example, PubMed, you can look up the journal's name. And some are a gray area, honestly. Some start out great, and then the peer review process goes down in quality. And at what point does that just become that you're paying $3,000 to get your article published? So I would just Google, honestly. There's things like ResearchGate or other communities of researchers, and you can just ask, you know, does anybody have experience with this journal? But definitely be on the lookout for journals that will take your money and not have a peer review process.
So Elena, it's Michelle here. I'm just going to push through some of these other questions for you. So the second question is, how do you like to incorporate qualitative data in field epi reports? Is the preference to have it in text or in tables, or what works best for the story?
Yeah, did you want to handle that? You know, as an editor, I'm sure you've seen lots of different formats.
So I think my personal preference is to put the qualitative data in tables. I just find qualitative data is a lot easier to visualize and view in a table. But again, I think what works best for the story is also more appropriate. And it depends on, I guess, the content and the amount of qualitative data that you have. Again, I think going back to sort of what Elena was saying regarding coming up with your results, always try and pick the 2 or 3 key tables, figures, illustrations that show your data the best, and then work from there. So the next question then is looking at the criteria to publish submitted papers and how long it takes the process between submission and publication. Elaine, are you happy for me to take that one as well?
Yeah, you could definitely talk about WPSAR's experience.
Okay, so in terms of the criteria to publish a submitted paper, that does depend on the journal. Typically, it has to be a study that hasn't been published before. It has to fit the scope of whatever journal it is that you've selected. So for WPSAR, our scope is on papers that talk about the surveillance and response to public health events and within the Western Pacific region. Other journals would have sort of their own scope, and it's typically the scope that is the criteria to publish. In terms of how long it takes, it can vary. This is almost the how long is a length of string type question. Some journals do rapid publications where there's a 1 to 2 week turnaround. Our average time is between 3 to 6 months, but can take up to 12 months depending on several things: the peer review process, how quickly authors get responses back after the peer review process, and the sort of publication process as well. So it can be anything from a couple of days to a couple of years, but typically is sort of around that 3 to 6 month mark.
Mm-hmm. Yeah, the submission process really only takes as long as it takes you. You do have to prepare some documents, but if you could do it in a day or a week, you can do it. But sometimes it takes a long time to get all the authors together and get the information. Yeah, so we had a few other questions, but it looks like they've been answered in the chat. If anybody has any other questions, feel free to pose them. And if not, we can see you all next week, same link, same time. Any last questions? Well, looks like we're right on the half-hour mark. Well, thanks everybody for the great questions, and yeah, keep in touch. Keep an eye out for TEPHINET activities. We've got a lot going on this whole month. We've got a supplement coming out with a lot of great field epidemiology research, if you want to see examples of field epi articles. And we're definitely looking forward to seeing you next week. Bye, everyone.